What's up, you guys? I'm Dr. Nick. Many of my subscribers have been asking for the entire full-length video of this cyst that was growing on this toe. So here it is. This is a pedunculated type of a cyst growing off of the adjacent border of this toenail. And what we did was excise it surgically. The patient was actually having her bunion corrected on the contralateral side, or the right side. So at the same time that procedure was scheduled, we booked it for the operating room to remove this small cyst. So first you can see we are freeing up this cyst from the cuticle area, or the eponychium as it's called. And it was actually growing under the cuticle. So it's not growing from the toenail and it's not growing from the skin near the nail. It's growing under the cuticle. So we're using a small curved blade and we're gently excising the cyst by holding it with a pair of forceps. And you can see where we freed up under the cuticle, that's where the stalk of the cyst was growing, which is more like the origin or where the cyst is coming from. And we're trying to make sure we remove it in its entirety, and that's why we're going under the entire cuticle area. You can see it was removed, and now we're using that scalpel blade to shave away or excise some more of the origin of this cyst to make sure that it doesn't grow back. Usually there's a stalk extending from wherever this is coming from, and in this case it was growing under the cuticle. So we're just making sure we got it all, and that's what I'm doing here. I'm again just scraping layers of skin away because there could be microscopic cellular levels that we can't see. So then after that's done, we're cauterizing it. This is an electrocautery. It's hooked up to an electrocautery system, which causes a burning of the tissue to stop bleeding and maybe cauterize some of that stalk where it formed. And now we're going to use suture, which is absorbable, but we're putting it through the nail plate. And this is going to just reattach the cuticle or the eponychium back to the toenail so that there's not an open space for any bacteria to collect. We're just kind of pulling the eponychium or the cuticle back down to the nail plate. And these sutures we can either remove, or as I said, they were absorbable, but you need some sort of bodily fluid, such as your interstitial fluid that's in the dermal and extracellular layers, to kind of absorb this stitch. So if it's external, as in this case, eventually it will break down over time and just kind of fall out. Or if it's bothersome, a small cut to the stitch will allow it to be removed. It's very simple. It's done in the office. And these stitches are left in. A Band-Aid goes on the toe, and the patient leaves the operating room fine with no problems. It's a very simple procedure. And that's it. Thanks for watching. If you have any questions, please leave them in the comments section below. The likes and subscribes really help to keep this channel going. I really appreciate it, and we'll see you in the next video.